Hey, this is Dr. Adam Goodman, orthodontist in New York City. I want to show you a case that really exemplifies one of the huge advantages of Invisalign that I don't think is discussed enough. Here we have a case that is a very moderate situation. The bite is good on the sides. There is some overlap of the front teeth or some crowding. This is moderate crowding, and the lower has moderate to severe crowding. And there's also a deep overbite. Now, you could say that this patient doesn't have terrible teeth. This is not an amazingly complex case. But I promise you, having been an orthodontist for 32 years, in 9 out of 10 orthodontic offices, at least until recently, this would be 2 years of braces. Nobody would individualize it or say, this is a moderate case, we can do it in 15 months. It would be 2 years of braces. And we know that braces can be painful, that things break and poke, and we know that you can get cavities around braces from not brushing well, especially teenagers. We know that there are limitations on what you can eat to avoid that breakage. So we know some of these advantages, hopefully, about Invisalign. But here's what's not discussed. When you use aligners, especially for a moderate case, and even for severe cases, but for moderate cases, it is incredibly efficient. This case, I set up a plan with 30 aligners, and that's 30 weeks. And now this is how the patient is. The bite has opened beautifully, and that has been a knock about Invisalign in the past. This is great bite opening. Look at the alignment of the arches. It is almost spot on. Maybe needs a little bit of tweaking. This tooth is still out a little bit, so I'm going to do some refinement of that, and I'll need 10 more aligners. On the lower arch, look at how much straighter that is. Now, this tooth is still not ideal. Well, guess what? I'm going to get 10 more aligners. That means I'll be done with this case in about 10 months. And, some orthodontists, I think, still are afraid that a parent will not understand that, hey, a treatment that took 10 months, should that be less expensive? But, you can make the case that if you can get a great result in twice the speed, that's almost should be due a premium, like a contractor who's doing work in your house who gets the same beautiful job twice as fast. I mean, who does that? And so there has to be a change in mindset. And I try to explain this to my patients that, in this world, there's so many advances in medicine and technology and everywhere. And yet 2 years of braces is still the norm. And so this case is going to be complete in 10 months with a beautiful result, with all the benefits of removable aligners, the invisibility, the comfort, but the clinical efficiency, when you know how to plan movement of the teeth on a computer, is superior to braces for many, many cases.